Hi, I'm Dr. Catherine Logan. I'm an orthopedic surgeon at Colorado Sports Medicine and Orthopedics. I'm going to talk to you a little bit today about ACL injuries. So we know there's at least 100,000 ACL ruptures that occur each year in the United States alone. These are occurring in both our recreational and our professional athletes. The majority of these athletes do seek operative care or ACL reconstruction. However, there is a select group of people who do manage with non-operative care. About 50% of these also have sustained an additional injury, such as injury to the meniscus, the surrounding cartilage, or other ligaments about the knee. Because of this, a very thorough workup is necessary to understand the extent of injury. At the time of injury, athletes often are planting their foot and pivoting or twisting, and this injury is commonly a non-contact one in nature. Individuals often describe an audible pop at the time of injury, as well as an immediate onset of pain, swelling, and oftentimes difficulty weight bearing. On exam, we assess your range of motion, the symmetry of ligaments on a side-to-side comparison of both knees, as well as something called a Lockman test, where we're looking at that forward translation of the tibia upon the femur. X-rays are evaluated for alignment, as well as the presence of degenerative changes in the joint if they exist, as well as for fracture or an avulsion injury. The MRI helps us assess the integrity of the ACL itself, as well as looks for additional injuries, as discussed earlier, to the meniscus, cartilage, or surrounding ligaments such as the MCL or the PCL. The torn ACL is reconstructed with a new ACL graft. Both ACL surgical technique and graft selection have undergone an immense amount of research in the orthopedic surgery literature. Final graft selection for ACL surgery is based on a discussion between the physician and the patient and considers all of these factors in play. Following ACL reconstruction, an individualized, criterion-based approach to rehab is essential to optimize your recovery. While athletes once followed time-based progression protocols, the tide has shifted to more criterion-based protocols. As a result, we have integrated extensive exercise testing in our follow-up visits at our clinic with our Cosmo Fit Lab. We have biomotion as well as force mat exercise testing to best interpret how everyone is doing following surgery with regard to their biomechanics and their function. This is crucial to providing this information to the physical therapist to make sure patients are progressing at the appropriate rate and they're better able to reach their goals optimally.